Hi, I'm Dr. Janice Morrow. Thanks for joining us for another episode of American Mood Swings, where we talk about the brain and all things related to mental health. Welcome. I'm Dr. Janice Morrow with American Mood Swings, and today I'm here with Dr. Michael Ingram. He's a Los Angeles-based psychiatrist who specializes in obsessive compulsive disorders and attention deficit disorders, ADHD.
Yeah, so obsessive compulsive disorder is it's diagnosed by a clinician. It's a clinical diagnosis, so there's no test, no blood test or imaging study that's going to diagnose it. It's really about the psychiatric interview and sitting with a clinician that understands obsessive compulsive disorder and then can make the diagnosis. So it's my opinion that the best mental health care is a combination of therapy and medication management. I look at medicine as a tool. I don't think it's the end all be all. I think it's a very small part of mental health treatment. But I think therapy is very important. And when you're dealing with people's mental health, to think that you can sit with somebody for 15 minutes or an hour and get to know them to the degree that you want and really help them, it just doesn't work that way.
Good evening. I'm Janice Morrow with American Mood Swings, and I'm here tonight with Sean Perry of the nonprofit We Are Hope. Let's talk about the mission and what We Are Hope is and where you are.
Yeah, so we aim to bring normalization, education, and a message of hope to those that are currently struggling and don't have financial means, right? The goal is to level the playing field, to make sure that all children, regardless of income, have access to mental health supports.
Let's talk about what are opioids for people out there watching the show. Most everybody out there has taken an opioid at some time. You went in for a root canal, you had some surgery, a family member. So talk about what opioids are and why they're so addicting. You mentioned in some of your videos that I've seen on YouTube how they hijack your brain. So let's go there.
Opiates are fantastic drugs in the emergency department, in the pre-anesthesia for surgeries, for certain chronic pain patients, and even in that area it was overused and abused, certainly for hospice patients. If you were in Germany today, last year, 20 years ago, and let's say you had a torn ligament on your shoulder or something, and you went into your physician's office, if you asked the doctor for opiates, he'd look at you like you're crazy. Not in a accusatory type of way, because there wasn't issue there, but it's like, who needs that for a torn, let's say, torn ligament? If he offered it to the patient would look at the doctor like he's crazy. The point of that is how we set up the way we perceive things is a function of our society, marketing, and our political economy.
Good afternoon, everybody. I'm Dr. Morrow. I'm here. I'm with American Mood Swings, and we're here with Dr. Kiefer from Brain Health Hawaii in Honolulu, Hawaii, and Angela Keene, his medical marketing professional. And we are going to discuss electromagnetic stimulation. All right. Well, yeah. Why don't we just jump right in and discuss what magnetic stimulation is because most people haven't heard of it.
TMS, or transcranial magnetic stimulation, is a broad and growing field. Repetitive transcranial magnetic stimulation. Many people will automatically start to think about, one flew over the cuckoo's nest. That's electroconvulsive therapy. That's delivering sort of like an overwhelming amount of energy or current directly into the brain, so that it essentially leads to a massive convulsion seizure.
We are here in West LA with Debbie Casper, who's a longtime entertainment industry professional, actress. And welcome, Debbie. Thank you so much for being here.
My pleasure.
And we're going to have a really candid discussion about addiction.
First time I had a taste of alcohol, I was about 4, because my parents were alcoholics. And by the time we were old enough to look over the counter of the kitchen, we became the bartenders. So my father would wiggle his ice, and that would mean one of us would have to go get him his Canadian Club and water. And I was really curious, as any kid would be, as to what is this juice that everybody's drinking that makes them so happy? And then mad later, but initially happy. So I would go into the kitchen and I'd pour it into the glass, and I would use my little finger as a swizzle stick, and I'd put it in there, and this is, like up here. I'd put it in there and I'd swizzle it around. And then I did something that I guess any kid would do. I would taste it. Like, what is this? I taste it, and here's what I believe qualifies me as an alcoholic, and I believe I was born an alcoholic because I'm 4 years old. I put it in once, and I went, ugh. Ugh. And I just kept drinking it, tasting it, until it tasted good. So that was my first time. And then my second time that I remember, then I quit for a couple years. And then my second time was at my parents' house. I was 12 and I was tending bar for a 4th of July picnic. And it was like, one for you, one for me. And I just started drinking vodka and Coke. Ugh. Behind the bar, I'm just drinking vodka and Coke. And I got so drunk that they, sent me to my room because I couldn't stand up without twirling. But then I, became a pretty regular drinker all through high school, But yes, to answer what you said about Matthew Perry, I think most alcoholics, and certainly me, describe it a little differently, but it's all the same thing. It's like you become whole. It's like you're like not quite right. You have a drink, and I'm smart, I'm pretty, I'm popular. Everything that you ever wanted to be, the alcohol gives you the courage to be that. It really gave me a lot of courage to do things I would never do. I did things I wouldn't do today, and I have, a lot more confidence than I did then.
Once somebody's diagnosed, then can talk about some of the different treatments, and I'm sure they change for the level of severity. If somebody just taking a medicine or somebody who needs to be committed, and how that goes down.
Well, obviously commitment or being put in the hospital is the last resort. Right. So what we try to do is identify symptoms early. That's the big key in almost every illness, but particularly in psychosis, is you try to identify these illnesses as early as possible, because the longer someone goes sick, where they're having psychotic symptoms, the harder it is to treat them, just like any other illness. Imagine, for example, you had some kind of infection. If you get antibiotics right away, you're probably going to be a lot better than if you wait 2 weeks, 3 weeks, 4 weeks before you go get treatment and your body has already gotten infected all over the place. Same is true with psychosis. The earlier you can actually identify the illness and treat it, the more likely you'll be successful. We call it the duration of untreated psychosis, or DUP. Duration of untreated psychosis. So the longer the duration of untreated psychosis, the worse the outcome. So the key is identifying these symptoms early and treating them early. Now you ask, what kind of treatments? Well, the good news is that for positive symptoms, the hallucinations, the delusions, the paranoia, they respond normally very well to a class of medications called antipsychotic medications. So we try to start people on those medications early on in the process, and most of the time they work. They really help people with psychosis. The trouble is that the other symptoms, especially negative symptoms, don't respond as well to the antipsychotic medications. We require other kinds of treatment, more psychotherapeutic approaches to improve negative symptoms in those patients who their positive symptoms are well controlled by medications.
Thanks, everybody, for joining us for another episode of American Mood Swings, where we talk about the brain and all things mental health. Hope to see you next week, and please share with your friends.